Delivering oxygen requires us to now have a oxygen tank and regulator assembly that is ready to deliver oxygen. Now, to get the oxygen from that tank to a patient requires us to decide what the delivery device are we going to use. Here on your video slide shows a few different devices. As we go through it, on the right topmost corner of this video slide is what looks to be a nasal cannula or nasal prongs. You see within that circular bunch of tubing, there's a connection where two prongs come through. There's a tab in the middle of that. That goes into the nostril, and the tubing connects up to your flow meter. The nasal cannula may have two different sizes, one for adult and one for pediatric. This passive flow device regulates the amount of oxygen and percentage of oxygen being delivered to a patient. We would usually start off at 1 liter per minute to the maximum of 6 liters. Anything more than 6 liters is highly irritating to the nostril and nose. Again, the limit is 6 liters and below. If we require more, then we would move down to the lower right-hand corner, which is a simple face mask. It's simple in that it's just a mask connected to oxygen tubing. This we can give higher flows of oxygen, usually about 6 liters up to 8. It requires us to have that oxygen and the flow meter set, but there is only oxygen coming out, and whatever they breathe out goes directly out. We rarely use this device as we go directly to the next one. Center of the screen, large plastic bag below the mask. This is called a non-rebreather mask. The device has a mask. On this mask we have a one-way valve which allows air to be blown out, but nothing to be breathed back in through the mask. So only oxygen that is coming from the oxygen tubing that extends from the tank and now going into that bag below the mask is 100% oxygen. This is a simple delivery device that allows us to administer at least 80% or more percent of oxygen to our patient. This mask device here, this non-rebreather mask, on that passive bag that gets inflated through the delivery from the oxygen tank, will stay inflated, and there's a one-way valve just above that. So when the patient inhales, breathes in, that one-way valve opens up and that bag will start to deflate as the patient inhales. When the patient stops and exhales, that one-way valve over that plastic bag closes, allowing the carbon dioxide that they're breathing out to go directly out into the environment. So the caveat here is when we are using this non-rebreather mask, it's to set this flow meter at 10 to 15 liters or to maintain that bag stays inflated. In some cases, patients may be breathing quite deeply, that at 10 liters, they're able to totally deflate this bag. In that case, we want to make sure that we increase the flow meter. This is the end of the regulator, and we want to increase that flow meter from 10 to 15 and perhaps even up to 20 or 25 liters per minute. But the caveat is to make sure that we kept that bag inflated at all times. Now the last device down there in the lower left hand of your video slide is a simple face mask for pediatric. We'll have different size masks for different type patients, pediatric ones and adult settings. Again, there's no variance between the amount of liters that we prescribe in the face mask. It's usually the same. It's probably around 6 liters to 8. Nasal cannula again is 1 to 6. And the non-rebreather mask, and in this video slide, this is a pediatric face mask to the non-rebreather, We can switch that out, or you would grab a non-rebreather mask that is more for the adult setting, for your adult patient. But we're trying to keep the bag inflated and that our liter flow rates are at least 10-15 liters and above. Please use please use the correct flow rates. Please use your skill sheets. And we would need to now start to understand, as we're using supplemental oxygen, how much more percent oxygen are we giving from room air? Again, use your skill sheets as you practice.